Okay, so welcome and good afternoon to this spotlight session sponsored by PENTAX Medical. This session is about ergonomics in endoscopy, and I think this is an increasingly important topic for our health and well-being of the entire endoscopy team. And so this session is going to be very practical and interactive, and I'm very pleased to be joined by Siau from United Kingdom and from Stacy Markwell from the US, who's a physiotherapist, and we'll give you a lot of insights, practical tips, and analyze your posture, your scope handling, and also the body movement, and also from a physiotherapeutic aspect. So I think we get started, yeah?
Fantastic. So we'll start off with the poll here. How many of you do endoscopy? Can you put up your hands if you do endoscopy regularly? And then the next question is, how many of you have had an injury related to endoscopy? So you guys are amazing. This is less than 50%. Okay. How many of you, of those who have had an injury, have to have time taken off work because of that? So there's more hands, and non-respondents have got their hands up. That's okay. And for those who have had injuries, hands up if you have had a physiotherapist assess your endoscopy practice or have had some kind of rehab or aftercare. Okay, so that not much in terms of aftercare. So this is the latest meta-analysis published in ESGE journal based on over 7,000 endoscopists. And the prevalence of endoscopy-related injury was about 2/3. But we know that other studies have had prevalence estimates of around 80% or even higher. The most common sites were of the hands, the lower back, and the neck. And there is a gender inequality as well, with females being more likely to have injuries. Also, if you do more endoscopy and have been around for longer, you're more likely to have be affected. About 1 in 6 require sick leave, and those affected may have had to change what they do and how they practice. Very importantly, less than half of us have had formal training in ergonomics, although this is improving in North America and also with ESGE initiatives. So we'll start off with a demonstration on how to hold the scope, and I'll show my colleagues here how I do it.
Yeah. So I think it's very important when you start endoscopy that you just pay attention a little bit how you position yourself towards the bed of your patient, that you pay attention how you position your monitor. So how do you do that, Keith?
So I put my hand in an open position, and I like to have the umbilicus over my wrist. I know that in the UK the teaching is for this position where it's a bit more flexible, but I find that for me, because I have quite small hands, it fits better with the umbilicus in front of my hand so that I'm carrying less weight. And then for my right hand, I have a pincer grip position so that I can roll the scope. But importantly, your posture is important, the bed height is important, the monitor, etc., which we'll go on to later on. But I wonder how you hold the scope, whether there's any, because we can have variation here.
Yeah. I do it exactly the same. I think it's very important that you have this part at the medium line of your wrist. Otherwise, you have much more strain on your hand, and it also assists a little bit in your movements. And of course, if you have smaller hands, you need to adjust. And what you mentioned also to the fingertip. Don't use a wrist tip, otherwise you need to maneuver your scope like this. It has much more strain on your arms and forearms, and
it's also important to avoid overuse of your thumbs. And in ERCP, I had big problems with my thumbs because of the elevator. And now I tend to use locks so that I'm avoiding extreme movements of my thumbs. I use my right hand, but also I'm using the C-shape position that the American society is very keen on, the C position that you can see on the screen here, instead of externalizing a loop. And this helps reducing strain and reducing excessive torque with your right hand. Thank you.
Perfect. I think most important is also, you already mentioned bed height, monitor height, where you position your processor. So make sure the bed height is at least at the height of your hip. Yeah. Otherwise, you will make a forward extension. Make sure that the monitor is at the height of your eye, of the horizontal eye level, and it's best if the processor and the supply part comes behind you and goes along the left side of your body.
So as a physical therapist who goes into the procedure suite and works one-on-one with gastroenterologists to help them improve their ergonomics, I'd like to show you a couple of tips that I have picked up over the years and demonstrate it with these two. One thing that you're going to see if you've started to read some of the ergonomic literature is it talks about at the beginning of your procedure that you should get in an athletic stance. And this is probably the most skipped over or misinterpreted piece of the literature that I see. So when you're starting your procedure, go ahead and
I'll stand here so you can see me better.
So when you're starting your procedure, you're looking good. You want to make sure that your feet are shoulder width to hip width apart. That's the easy part. That's the part everyone gets right. The piece that is often missed is the most important part for creating a stable yet adaptable base for your upper body to work on. The purpose of the athletic stance is to make your upper body work less. We want less tension in the neck. We want less grip force so that your fingers can move more easily and manipulate the controller and the equipment with less force. So when you're standing, you're going to know, this is actually great right here. Your feet are shoulder width apart. This is the important part. You're going to ground your feet. You're going to create gentle pressure through 3 points of contact simultaneously on both of your feet. The heel, the base of the first toe, and the base of the fifth toe. So try that with me. Just gently press down. Did you feel that your legs became active when you did that?
Yes, it's
Yeah.
a bit more balanced.
Yes. So his knees are still straight, but they're no longer locked in extension. And I frequently see physicians, they separate their legs, but then they lock those knees in extension, and we've lost that stable, adaptable base. We want the lower body to support the upper body. So you start your procedure, you've grounded your feet, but now you have to access the floor pedal for something. You access the floor pedal, you come back, reground your feet. Continue to create that stable, adaptable base. Just like a tennis player is anticipating the return, they're constantly getting ready for it. You're not moving, but you're going to be prepared for movement each time. When you go through a tough turn, or you reach the cecum, or you ask for equipment, anytime you have a natural pause in the procedure, you're going to make sure that you have grounded your feet. Does that make sense?
That's so important. And on that note, having good footwear is important. Good shoes. I don't know if there's a particular brand you can disclose them, but perhaps not. And also having a foot mat. There's a foot mat shown here that's hard to see, but does having a foot mat help?
So your shoe choice is very important. You want it to match your foot. If you have particularly flat feet, we're going to need a more cushioned foot support. If you have mats in your room, it's important that you use them correctly. The mat needs to be centered with the person performing the procedure. Sometimes there's 2 mats in a room, or there's multiple people. Whoever is holding the scope is who the mat should be centered with. You want to make sure that it's tucked underneath the bed so that you're not trying to keep your feet on the mat as you lean towards the patient that you're working with.
Thank you.
About unstable shoes. Is this necessary? Is this helpful? Unstable shoes for example.
Unstable shoes?
Unstable shoes.
Oh, you're wanting to know if you should have unstable or stable shoes?
Unstable.
So if you're going to be on an anti-fatigue mat, the anti-fatigue mat is going to create these micro instabilities. Those micro instabilities help us keep our lower legs active and help us weight shift. So we stay active for longer and can stay in better alignment. If we take a high cushion shoe and put it on a high cushion mat, we can create too much instability with it.
Move on. So this is the ESGE. I'm speaking heresy here, talking about another society. But this is the bullet point recommendations from the ergonomics guidelines. They have a structured, number one, structured training curriculum. And I would suggest checking that out to all your new fellows, because fellows get injuries too. Number two, optimized pre-endoscopy checklist with bed heights, distances from the screen, and then also the distance from your elbow to the bed. Number four, anti-fatigue mat. Number five is stretches between endoscopy. And this is something that Stacy can demonstrate, and hopefully you can join in with us here.
So the majority of my work is one-on-one, working with physicians, creating wellness plans that involve a piece of the plan that's called ergo breaks. Stuff you can do in between your procedures to make sure you can get through your day with less pain, less tension, and stay in better alignment. As a result, every ergo break plan I write is different. Joe and I are going to walk through a sample ergo break sequence, and I would encourage you to try it with us. But when I look at this list as an think, wow, that is a lot of exercises. As you practice this, go through this, I want you to figure out what works for your body, what gives you release. When you finish going through this sequence, where do you feel better? And that's where you're going to focus on during your precious minutes in between procedures. So now every plan is different, but one thing that is similar about all of you, whether you're in good alignment or not, your hands and wrists are interacting with equipment for an extended period of time, multiple times a day. So it's very important between each of your procedures that all of you move your hands fully. So full finger extension and flexion, you can easily move this into washing your hands or removing your PPE. You want to make sure you're moving the wrists in circles both directions and flexing and extending the wrists with the palms up and the palms down, with the elbows bent as well as straight. You will sometimes see in the ergonomic literature people applying overpressure to that stretch. Would you show them that? And this is going to be helpful for you if you've developed stiffness at your wrists. Maybe you lift a lot of weights or you do a lot of knitting, you do things that develop stiffness. That overpressure might be appropriate. If you're having active symptoms between the elbow and the hand, though, we don't want to apply that force until a physiotherapist has instructed you to do it, as that can protract your recovery. Moving up the body into the chest, I work with a lot of gastroenterologists who develop chest tightness. So this is a common stretch I give to them. All of you have shoulder blades on the back that start in a slightly different position. So before you put your hand up on the wall, all of you, I want to stretch or widen your shoulder blades to improve your scapular position. Then you're going to put your hand up on the wall. Most of you are going to find that this 90 degrees is sufficient for opening up your chest. Step forward with the leg that's, there you go, closest to your hand, and you're going to shift with that wall blocking your hand. And you can turn your sternum away like Joe is doing. That's going to get your pec major a little bit more. Now come back to the center. If you're somebody whose shoulders want to tip forward, you might be more comfortable if we slide your hand up a little bit more and then come forward. Shift your weight forward just where you were. Perfect. To open up that pec minor. If you were busy over the weekend and your shoulders are starting to feel a little sticky from doing so many procedures and whatever activities you enjoy, you can also do this with your hands right by your side and lean into the wall. 3 different options. Find the one that works the best for you and stick with that one. Be careful that you don't allow your shoulder blade to tip forward. So In this position, she may feel a stretch, but what she's stretching is the anterior inferior capsule of her shoulder. We want to make sure those, yes, right there, those shoulder blades are retracted and that scapular position is optimized. Moving up to the neck and upper back, many physicians complain of soreness in the upper back and in the neck. The most important thing you're going to do before you start this exercise is lengthen the back of your neck. Often, we drift forward, especially when you're concentrating in your procedures. I've seen physicians when they're taking off polyps, they're often here. We want to make sure we're lengthening that back of that neck. You can bring your hands out to your side and kind of open that up to help keep that chest open during this. And then rotate the head left and right. Rotation is going to make those of you that are stiff in your upper neck feel a little bit better. And then you can side bend left and right. That's going to help for lower cervical stiffness. Now, if your neck is stiff but not painful, you can apply gentle overpressure on this as well. Just like that, yeah. So moving up to the spine, there's a couple of things you can do to open up the full spine. For me, I'm someone who's stiff in this area, so both of these exercises I would do in sitting. Again, I want you to modify this program to match you. So the first one, you're gonna bring your arms up and around. You're gonna kind of cradle your head and bring your elbows forward with it. Now, take your elbows and point them to the ceiling with that back of the neck elongated to get some nice extension in your thoracic spine. If your back is a little bit stiff, you might think about pushing your hips forward a little bit as you do that as well. And then bringing it down and relaxing. You can also work side bending, bringing your arms up overhead here. If you're more stiff in the mid-back, coming straight up and over will feel good. You can go left and right with that. If you're somebody who always keeps your floor pedal on one side and you're constantly shifting away from it and have developed tightness on that side, you might want to glide your hips into it a little bit more to get opening down a little bit further. And the next one we're going to do is for the hips and the legs. This twist is a really easy one that a lot of physicians I work with like. You'll step forward with one foot, bring both arms out in front of you, lengthen that back of that neck where we know you all get very tight, relax the shoulders, and then just pull your arms straight back to open up the chest. This is an exercise doing 3 to 5 reps in between your procedures will help you get that spinal mobility and hip mobility. When you go to the other side, you'll make sure you step forward with that side so you get the same rotation on that side. And then moving down the legs, most physicians I work with are either tight in their hip flexor or their hamstring based on their posture. So either exercise, try them both, see which one gives you that relief. The hip flexor, in the picture it shows the foot up on a chair, but this can be done in standing too if you don't have that. The trick is going to be to, yes, do that posterior tilt there so you get that length in there. You can deepen it by bringing your arm over your head if you wish. Good. And then a typical hamstring standing stretch or sitting stretch coming there, hinging from the hip, keeping that flat back. So again, this is just an option of a sequence you can try. I would encourage you to try the exercises, find which ones give you that relief, and allow you to be prepared to walk into your next case. Thank you,
So
Jeff.
moving on, I'm aware that we're a bit stretched for time. This is a hierarchy of controls that starts at the bottom to the way up. So training, better technique, changes in how you do your routine can certainly help. There can be other things that your hospital can help you with, which is packing less on a list, allowing breaks, bringing in an expert to monitor or observe your practice. But at the top, we also have engineering controls, because the principles and fundamentals of a scope have not really changed for that many years until more recently.
Aware that we are not all one size. We have different hand sizes, we have different heights, different strengths, and so we also have to address this, and this is somewhere where industry might help us. And So there is different adjustment of the endoscope, which might be helpful really, especially for long-standing procedures. So reducing the weight of the adapter of the endoscope itself might be really helpful in if you imagine you do a colonoscopy and an ESD, which takes like 2 or 3 hours, you will feel the weight of the endoscope. But you can also use, for example, these accessories, especially for people with smaller hands. Just adjust this small accessory to the small wheel of your endoscope, and it will facilitate the access of your left hand to control, even with smaller hands, the small wheel of the controls. And of course, it's also, you can manage or differentiate a little bit the control buttons and also the accessibility of the wheel, so you have less strain on your wrist, less strain on your thumb. So these techniques, these designs are really helpful, and I think we need more of that.
So I'm very grateful to PENTAX for sponsoring this session, and to all of you who have stayed here, but also to Stacy and Joe for showing us about stretching techniques. Today we have shown you that endoscopy-related injuries are very common, they are preventable, and also they are treatable with rehabilitation. I would strongly advise you or urge you to get a specialist physiotherapist into your unit if you have or know somebody who struggles with an endoscopy-related injury. If you want to check out Stacy's Ergonomic Wellness course, and there are sessions available, please book in, and you can find yourself and say hello to any of the PENTAX members here who will book you in a 30-minute one-to-one session with Stacy here over the next couple of days. Enjoy ESGE Days, and thank you for attending our Spotlight session.